chemotherapy accumulates in your body. So I also used to say to all my patients, and I'd say to people out there, your first chemotherapy is going to be pretty much a good indication of how the rest of your treatment's going. Hello and welcome to Breathe Strong. I'm your host Rachel, and this is our final episode of season 1 of Breathe Strong, so I hope that you've enjoyed it. In today's episode, we're going to talk about lung cancer treatment side effects. Our last episode, we focused on mesothelioma, and today we're going to focus on lung cancer side effects. Now, I'm completely delighted. We actually have a whole new team in the studio with us today, and the reason for that is that our lovely Charlie, it's her birthday, and so happy birthday, Charlie. So she's actually off getting ready for some fabulous big party tonight. We also send a big shout out to Mel, who sadly has got a nasty cold. So we miss you, Mel, and we wish you all the best, and we look forward to seeing you very soon. So before we start, I'm going to introduce you to my new team. So first of all, I've got Sarah. Hi, Sarah.
Hi, Rachel. Thanks for having me in.
Do you want to tell us a bit about your journey,
Yes, so my name's Sarah. I was diagnosed at stage 3B with EGFR positive lung cancer. That was in 2024. And then following progression to my brain in 2025, I became stage 4. So, I now live with stage 4 lung cancer. And I've had targeted treatment for that. And I've also had chemotherapy for that as well. Brilliant. And also stereotactic radiotherapy.
Wow.
So quite a few different treatments.
Okay. Yeah. Thank you for coming today, Sarah. Thank you. And hello, Maria.
Hiya. Thank you so much for inviting me.
You're very welcome. And can you tell us a bit about you, Maria?
Yeah, I was first diagnosed going to the hospital. I had no symptoms. I went for something else. And I got told I'd got a small tumour in my left lung lobe. And I went straight through to thoracic, was going to, it's all going to be cut away, Maria, don't worry about it. Didn't even get a stage or anything at that point. And then unfortunately I woke up with the surgery had been abandoned and I was stage 4.
Oh my God.
Because it had gone to my pleura.
Right.
And around my heart.
Right.
So, so I'm stage 4, but I have been like that for 3.5 years now. And I'm on osimertinib for all its sins and all its wonders. And I'm just living each day as it goes.
Brilliant. Thank you. Thank you, Maria.
Thank you.
And we have Natasha.
Oh, thank you so much for inviting me today.
You're very welcome. And do you want to tell us a bit about you, Natasha?
Yeah, so I'm Natasha, and I was diagnosed with stage 4 EGFR positive lung cancer about 3 and a bit years ago now. It's been quite a journey. I've been treated, I've been on osimertinib, which is TKI, for the whole time, but I did have progression in my brain about a year ago. So I had gamma knife to my brain, and I have also more recently had my left top lobe removed whilst being on osimertinib. So I was the first, I'm really proud to say this, I was the first female in the UK to have my lung removed whilst being on osimertinib and having progression to the brain.
Wow.
So so it means the treatments for lung cancer is like they're changing so quickly and so rapidly.
Yeah, and I think that's really interesting to note that our 3 team members here today, they've not just been on one treatment, it's been several treatments together, and they're still here, which is brilliant because, as you know, when I first started in lung cancer and was looking after EGFR patients for the first time, it wasn't as positive as it is now. Even then, we were still excited by by finding EGFR positive lung cancer because historically some patients didn't do well on chemo and we couldn't work out why. So, we're going to look at that today. We're going to focus mainly on EGFR positive lung cancer patients today. So before we start, I just thought it might be interesting because we now live in an era where lung cancer has so many more treatment options. There are tyrosine kinase inhibitors, there's chemotherapy, there's all different types of radiotherapy, as Natasha was saying, there's gamma knife radiotherapy, there's SABR, there's targeted radiotherapy, we have surgery, we have immunotherapy. But all of these treatments naturally come with side effects. And this episode, we're going to really just focus on two of those treatments, which is tyrosine kinase inhibitors and chemotherapies. Now, you might be thinking, most of you, we talk about TKIs, and we don't actually really understand what TKI means. And that means tyrosine kinase inhibitors. That's what these drugs are. So what is tyrosine kinase? Well, it's an enzyme which internally switches within the cells that control functions such as growth and cell survival. Now, in cancer, genetic mutations or an abnormal gene activity cause these enzymes to become overactive, leading to uncontrolled growth of cancer cells. So the inhibitors inhibit, stop or slow down that from happening. That's what they are. They're an oral drug. They're usually taken once a day, and they have changed the face of how we look after our lung cancer patients. We also know that recently there has been developments where we have been combining chemotherapy with TKIs, and there have been clinical trials to look at the effectiveness of this, and actually they have been very positive. So we're growing and we're learning all the time about how we look after our patients and keep them well and alive for as long as possible. But as I said, we know there are side effects with these drugs, and some of these, but not, it's not a full picture, but some of them can be fatigue, skin rashes like nail changes, actual rashes and itching on our skin, diarrhea, changes in our taste, which can reduce your appetite, make you not want to eat very much, then you lose weight, nausea. These are just a few of some of the side effects that we see from these drugs. So what we're here to talk about today is this is for people who may be on treatment or just about to start treatment. It's interesting to hear from other people what their life experience has been. So just to open up, what's been your experiences of being on drugs? I mean, maybe let's start right from the beginning. When you were told you were going to go on a TKI, what first crossed your mind? Did you have understanding what the heck that meant, Natasha? So maybe you could start then.
So when I first of all got diagnosed, the analogy that my CNS used was, she said, imagine a tree, okay? Your main primary tumour is the trunk, and then your metastases are the branches. Your TKI is going to hopefully chop the tree at the bottom, at the base, so that everything withers away.
Okay.
We talked, and so it's like a systemic treatment. She did talk briefly about the side effects, but I think the one thing that I would say to all the listeners out there is, please don't be scared about reporting side effects. So after I'd been on osimertinib for a couple of weeks, I developed the rash.
Right.
And I was so scared about calling it in. And it started off in my feet, ran up my legs, very, very itchy, swollen. And I lived with it for a couple of days. And then by the time it started getting into my eyes and so on, it became unbearable. Mm-hmm. I was so scared that they were going to take the TKI off me. Right. That I didn't want to call it in.
Okay. Because
I thought I could put up with the rash.
Yeah.
And putting up with that was better than coming off osimertinib. Yeah.
Mm.
Anyway, so I did. I ended up phoning it in because it just got unbearable. Got called down to the oncology unit, went down to the oncology unit. They literally gave me some antihistamines and it cleared it up.
Wow.
And so something, the fact is that a lot of these side effects are manageable. Mm-hmm. And I think it's saying to people who may be just starting out on a TKI, don't be scared. Don't be scared of calling it in, because actually a lot of these you can have treatment to deal with those side effects.
And maybe then as nurses, we should actually, and I mean, I used to say to my patients when I worked at the hospital, don't be scared, tell us, early. If you tell us early, we can treat it. We probably won't need to even interrupt treatment if you tell us early. But don't be worried. We're not going to stop treatment. That's the last thing we want to try and do, is stop the treatment. But I think maybe we need to be a bit more perhaps to the point about telling our patients that, so that they don't feel scared.
Making it really explicit about the fact is that you may experience these side effects. However, we can deal with those. Just let us know.
Yeah, that's a really good point. And Maria, what was it like for you? What was your experience?
Well, obviously I had to recover from the operation. So I was about 4 weeks before I started it. And I think I was just numb. I say this a lot. I shut down. I didn't know, because every cancer I've had breast cancer and skin cancer, and everyone has had where I've had the operation, it's been cut away, and I've had adjuvant therapy, and that was it. And then when waking up to stage 4, I think it took me a while to get used to that. Anyway, then eventually I was going straight on the chemo. The blood test had not come back to give me a mutation.
Oh, okay, yeah.
So I was actually sat in the consultant. She was on holiday, and she'd asked somebody to come specifically and to let me know that it was okay. You've got the best cancer gene mutation. And it went, and I didn't hear any more apart from a tablet.
Can I ask you a question about that?
Yeah.
Did that help when they said it's the best cancer?
No, not really.
No, I think that's quite a thing to say, isn't it?
Yeah,
there is
weird,
no best cancer,
like,
is there? But
no.
yeah.
But yeah, they did say that to me. But I think I grabbed onto that, and then, but they said it only works for 18 months.
Oh, right, okay.
Statistically,
so
at
they
that
gave you
point.
good news and then took it away.
Yeah. So I remember going then up to get my drain removed and just crying with my CNS and saying, I've only got 2 years, I've got to fit everything in, I've got to get well, that kind of thing.
Oh, my God.
So I don't think I properly listened, is my answer to your question, Rachel. I don't think I listened. I don't think I took anything in. I just went along with it and just took the tablet.
Wow.
And then what I would say to the listeners is, don't lose heart, because these side effects, they come in waves and it changes so often.
Right.
One day you're absolutely never off the toilet. The next day you've got nail infections. The fatigue hits you. And this is all really in the beginning. And then you've got to sort out when you take it. I can't take it in the morning because I'm asleep by 12 o'clock. Or something.
Okay.
Yeah, it really knocks me out. I don't think it's the drug that knocks me out. I think it's the fatigue hits or something.
Right.
So from the beginning, I've always had it on a night. But yeah, I was completely blindsided by the whole experience, and I don't think I really got used to the thought that this pill was going to save my life. But obviously, I learned so much, and you listen and you learn and you get out there and you're keyboard warrior, and so I got a lot of information. But they just gave me a photocopied from Macmillan.
Yeah.
On osimertinib, and that was all they gave me at that time.
Right. And I think, what's interesting is that I remember 2010, Alotinib coming along and being absolutely, as a nurse, when these new things come along for your patients and you think, for me, it was like my patients were all dying, and to have anything, hopeful for patients, but also for the nurses and doctors, this is like, we're celebrating.
It's like hope, isn't it?
And
Yeah.
hope. And I can remember after about 2 or 3 months of working at Guy's Hospital, I worked with the most brilliant professor, saying, I think nurses should do those clinics, because we would see our patients every time, rather than you coming and having to tell your story to a different person every time. So we started running nurse-led clinics. We were one of the first hospitals in England, because there was a hospital in Scotland that he was our mentor for nurse-led clinics on TKIs. And the difference, I think, with the nurse looking after our patients, because we spent that time, all our new patients got an hour with us. To talk about, this is your diagnosis, but this is what we're going to do about it. These are the side effects, and we would give them information, little diaries, but then we would phone our patients 7 days later because we knew that was probably when things were going to kick off.
Honestly, massive shout out to the LCNSs because
Yeah.
they've got me through so much. They're so approachable. And my oncologist as well. I'm so lucky with my team. And it was down to my Cheryl, an LCNS nurse, who said, "Oh, Maria, while you're waiting, let's just go do this blood test."
Right.
And she totally off her own back organised that for me because I hadn't seen a consultant by that time. And that's what came back on the day of my chemo to say that I was EGFR exon 19.
Wow.
From a blood test.
Yeah.
Yeah, you
Wow.
can do this blood
Yeah.
test called
It went away. I think
ctDNA.
was it to Germany or somewhere?
because I had the same one. I
You
had the
did.
same
Yeah.
one in the same
Massive shout
hospital.
out to
Yeah, so
you know.
this is a new
It is.
development that we're, growing in our expertise. So we know that cancer cells break off from the tumour and circulate. So a circulating DNA blood test is what it is. And in the blood test, they will look for cancer cells and they can then diagnose from those cancer cells what type of lung cancer you have. So this is, again, this is all why it's so exciting to see these things happening. So with screening and then going on to diagnose, we're getting faster. You were talking about having to wait. You were almost about to start chemotherapy because you'd had to wait so long for that test to come back. We're improving all the time, so that's great. And Sarah, what's been your experience?
I suppose if you're asking about my experience of osimertinib and coming into that, it's quite different because I didn't have osimertinib at my diagnosis. I was prescribed radical chemoradiation because I was stage 3B.
Right.
And so that's, at that point, exactly like Maria was saying, you can't, it's like a huge psychological thing that you have to go through. You've been diagnosed and you have to immediately face your own mortality. That's kind of what happens. And it's what I found when I was diagnosed and then met my team. I also have a really wonderful team at UCLH. And the CNS there was saying to me, we have a treatment plan. We have a treatment. And just those words I hung on to. Yeah. Because it was a really good friend of mine had said, look, you're now walking in the right direction. And that really helped, that understanding of, I wasn't even feeling that ill when I was diagnosed. I had a cough and it was getting worse, but it wasn't enough to think I'm gonna, to think it was lung cancer was just extraordinary. Yeah. So then, when of course you're diagnosed, it's terrifying, and you just think it's growing. You just your mind.
Of course, you
can't see it. You don't know what is happening. So I was really desperate and keen to start treatment as soon as possible. And I mean, when I was diagnosed, I was 40, so I was still childbearing age, let's say. And so this is also why my hospital were amazing, because they considered this fact, considered whether to freeze my eggs.
Okay.
And I just wanted to start treatment. I thought, if I can't be a mum if I'm not here. Do you know what I mean? It's just all these thoughts. It's really scary thoughts you have to think of so quickly. And I'd done a bit of investigation and found that there was a drug called Prostap, which I think breast cancer patients get injected into their belly, and it protects your ovaries.
Oh, really?
Yeah. So when I then went to chemotherapy, I spoke to my team about it, and they were like, yeah, let's give it a go. So I had this injection every time I had chemotherapy, and that then I was going through so many side effects during chemotherapy that just a jab in my belly, I didn't know what was doing what. So it was it kind of great. It was giving that, it was protecting that. And at the time when I was diagnosed, I was the treatment was curative intent.
Yes.
So then 6 months later, after 6 months of, after my chemoradiation, I had immunotherapy, durvalumab, because it's a bit of a difficult situation with NICE and with how different staging works. But after you've had chemoradiation at stage 3B, they don't prescribe osimertinib. Yeah, it's like the one stage that doesn't get osimertinib. It's very odd. So they sort of, my oncologist was great. We had a conversation about it. And he said, durvalumab is like belt and braces kind of thing.
Yes.
So let's do that. So I went through that for 6 months and then did a routine scans, including a brain scan. And, you know, after 6 months, they saw a mass on my brain. So the cancer, therefore, immediately at that point was restaged. And I changed my team because I was clinical oncology and I went to medical oncology.
Yeah.
To me, that day was as bad as diagnosis. It was just like a unbelievable day.
It's trust, isn't it, in your team? And
I was terrified to. I was like, but I know this doctor, and he's been through everything with me. How can you leave me?
I know. Yeah,
it was a really scary thing.
It's like a breakup, isn't it? Because you trust that person with your life.
Yeah. They're like, you know, they're kind of your god, right? You just do everything that. And he is a lovely man, and he, you know, had my back, and then you're just like, sorry, this is now your medical oncology team, and I was angry at my medical oncology team. I was like, what? I don't want you. I don't want you. I want to stay with this person and this team who's been, you know, who's looked after me and seen me through the kind of roughest of times. You know, a year and a bit later, my medical oncology team are like my heroes, and I love them and I hug them whenever I see them. But at the time, it was like when you're facing fear like that, you need something to really ground you. And in the past, it had always been my oncologist. He'd give me good news, he'd give me bad news, just been in the room for all of it. So then sort of being shipped into another room and another doctor was quite a lot to process. And then that day they gave me osimertinib.
Right.
So it was like I knew about osimertinib. I knew about it even before I started chemoradiation because it was known as the miracle pill. You know, you can live a full life with it. You've got EGFR positive. And I have to caveat this, as you know, like my EGFR positive, all of our EGFR positives are exons that respond to osimertinib.
Yes.
Not everyone's does. And there are other TKIs out there, but not for everyone. So we're within having EGFR positive, we're also lucky to have
the best cancer.
The best cancer. We have the best cancer within the best cancer.
Yeah.
It's funny that you should say that because when I first got diagnosed with EGFR positive as well, my CNS phoned me up and said the same thing.
Really?
And she said, oh, it's okay because we can put you on osimertinib and you're lucky. Because I think it's that lifeline, isn't it?
It is.
Yeah,
and,
it is.
And also, you know, like you were saying about being on chemotherapy and radiotherapy, people, and we talked about this morning, about this fear of chemotherapy that you're going to lose your hair, you're going to look like a cancer patient, you know, it's going to be horrendous, you're going to be vomiting all over the show.
Well, that did happen. But.
And, you know, well, come back to that, Sarah. And I remember Charlie saying in one of the first podcasts that she was in the bath and Max was banging on the door to break this incredible news that actually you're not starting chemo because you're going to be on this oral drug. And Charlie was like, yes, in the bath. And it was a celebration for her because it was, no, I'm not going to have to go down the chemotherapy route.
I think we probably all remember taking that first tablet.
Really, do you?
So I picked mine up 2 days after we found the brain mets. I was supposed to be starting chemotherapy as well. But then they found the brain mets, so I went straight on to osimertinib. And I remember picking it up 2 days later, sitting in the car park at the hospital, just unwrapping that first tablet. And I remember as I took that first tablet and that first swig of water, just thinking, just cure me. Just cure me.
Wow.
And, you know, and then also you look at this teeny weeny little tablet and you think, how can something so small do such an amazing job.
It's incredible,
crazy.
really.
And I know, again, it's like you said, not everybody's Exxon.
No,
you know,
it's
so
different
not everybody's
for so
able
many.
to. And also, of course, some people don't simply, it doesn't work for them as well. Whereas some people, you know, they may be able to stay on osimertinib for years. Other people, unfortunately, might only last for a few months. I feel like I'm one of the lucky ones. But yeah, it's incredible, this tiny little tablet.
I know.
But
Yeah.
We're
Yeah.
making advances, and this is what's so wonderful in this country. We're very lucky that we have some of the best oncologists in
Yeah.
the world in our country. There are still, you know, I've recently been to the British Thoracic Group conference, and it was just a buzz with, I think, 3,000 plus health professionals all there for one purpose, which was to find out what's going on in the world of treatment to improve our patients' lives. So it's amazing.
Yeah.
But just taking a step back, Sarah, because you mentioned just very briefly there about the chemotherapy, and I get the feeling it was awful for you. Well, what exactly was that like? Because on top of the chemotherapy, you also had daily radiotherapy for 6 weeks, Monday to Friday, didn't you?
Yeah.
What can you tell us a bit about that?
So I've had chemotherapy twice, once in 2024 and once in 2025. So I'll start with the 2024 batch. And yeah, I think the first time I had chemotherapy, it is an incredibly surreal experience. You know, you're sort of I remember lying in the hospital bed, and you have I had a cannula in, and all these drugs arrive, and you just can't believe that you're the one having chemotherapy. You're just like, how is this me? You know, it's just like, it's a very out of body experience, I would say. And then, so my first sort of round was three rounds every 3 weeks. And after the second round, I then started the radiotherapy. And the first drugs I had was cisplatin and vinorelbine.
Right.
So one platinum doublet, is that what it's called? Platinum doublet?
Platinum doublet, yeah. We use these fancy words.
Sounds kind of nice in that way, but it's not very nice.
It sounds like it's the platinum.
Yeah,
Yeah, exactly.
Gold standard.
That's what it meant.
Yeah. Oh, it's nice because it's like got platinum.
It's metallic.
Yeah.
So a lot of chemotherapies have a metallic element to them.
Yeah, and the cisplatin is the one with the metallic element. So, I mean, the first round, you just don't know what to expect. And I remember always coming out. Oh, I came out that first day, and I have to name drop here because it is so surreal. When I was in my ward on the first day, they had these signs up for going to be some filming. And I'm a filmmaker, so I was like, oh, yeah, that's fine. You know, it's probably just a charity thing or whatever. Of course, so we had to sign something. And then there was a bit of a buzz around the ward, and like it was really busy. And there was these bouncers on the door.
Wow.
And I was there thinking, these drugs are so important that people can't come in. Like, okay, I'm, like being looked after here.
Have you been signed an NDA?
Yeah, like they're looking after us in like really incredible fashion. Yeah, we had like strong men on the door. And then freaking King Charles walked in.
No.
Yeah, the first day of my chemotherapy. Was
Wow.
King Charles and
You were
Camilla.
there.
Yeah.
Got called in.
That's because it was platinum, you see.
It was
Platinum.
Oh my God.
I'm going to ask for that.
It was just like as if the day couldn't have been more unbelievable.
Yeah.
It was then that. So that was kind of a buzz, and my partner at the time, he was there, and he was like taking photos for everyone, and it was all just then about it. King Charles. And I was
what
like,
about
no,
me?
hold on a second.
Yeah.
I'm the patient now. But it was kind of, it detracted from it. And you just, in these moments of like, you can't believe this stuff is happening to you, you just have to laugh. And like, so the day itself of chemotherapy for me I was always on a bit of a high. Like you're also given a lot of steroids, you're given a lot of like painkillers. And then it was that, that night was for me, the nights were when it kind of hit.
Right.
I had very bad nausea, very, very bad nausea, constipation.
Right.
And they were the two kind of worst side effects. And then after the second round, it kind of got worse. And then the third round, I ended up in A&E that night.
Wow.
I wasn't able to hold anything down.
Okay.
But I actually think that was also because I was having radiotherapy. I couldn't eat and I couldn't, swallow. So there was a lot going on. But I don't want to put people off chemotherapy, actually.
No.
I don't want to scare people. I had chemotherapy the second in 2025. And that was then carboplatin and pemetrexid, which I believe now is more commonplace.
Yes, it is, yeah, because it's cisplatin that actually makes you sick.
Yeah.
So we know from, we didn't really use it very often in my trust I worked at because of the sickness. Young women suffer more with sickness with cisplatin than older people, and one of the things that we were advised were you should always ask your patient if they'd had children, did they have morning sickness, because if they had morning sickness they're going to get chemo sickness. So we would counsel our patients very early on about nausea, because often nausea can be one of those symptoms that's undertreated but can become psychological. So I've had patients before where they've not been on chemo for a while, but they've come into hospital, and coming into hospital makes them vomit because the psychological impact.
Extraordinary, isn't it?
So I was used to think the one symptom I need to absolutely get on top of is nausea.
Yeah.
Because it becomes, I think the word's intractable. Chemotherapy accumulates in your body. So I also used to say to all my patients, and I'd say to people out there, your first chemotherapy is going to be pretty much a good indication of how the rest of your treatment's going. If you feel sick on that first chemotherapy, they possibly need to change your antiemetics and give you more antiemetics, different types, because there's many different types. And monitor you really closely for that so that it doesn't get to that stage. Did you try any alternative, like ginger or anything else for the nausea at home?
Yeah, I did try. I'm very kind of into homeopathic medicines to support treatment. And I tried ginger. I drank a lot of water when I could. I'm trying to think. I think the more experienced I got with chemotherapy, it is almost about the to kind of prep for it.
I was wondering about the bowels, with the constipation. Can you prep pre to the... You know what I mean? So take lactulose a few weeks. So you...
Yeah, that is what I started to do.
Did you?
The second time round, maybe the drugs were not cisplatin and not as heavy, but they were still heavy, platinum doublet.
Yeah.
And so I started... Because I really got bad constipation, which is dangerous as well. And so I would have a lot of prune juice beforehand. But now I can't drink prune juice. I can't go anywhere near prune
Really,
juice.
that's interesting, isn't it?
Like
you
that
see, this is how
connection.
important the psychology and well-being is, isn't it?
Yeah.
It smells, sounds, sight, isn't it?
Yeah.
You remember and it's held there.
Like respect prune juice, but not for me.
Yeah.
Right now, unless I need it.
Did you do that Tinker Tailor Soldier Sailor? Mum used to do that with prunes. So you'd eat the prune, and when it had the seed, and you'd be able to do the little rhyme to it.
Oh.
Tinker Tailor Soldier
Rich
Sailor,
man,
poor man, beggar man, thief. And however many you've got, that's what you would be.
Mine was with clementines and like pips and
yeah.
Otherwise, I don't know what I'd have been on that.
I could only do one, so I never. It was always a tinker.
So you're a tinker.
Yeah, I'm a tinker.
Soldier, sailor.
Rich man, poor man, beggar man, thief.
I wanted to stop at rich man.
Yeah,
that's what I would do.
Yeah,
Sure.
definitely.
Yeah.
Sorry, it was a childhood thing that came to me then. I'm sorry.
But yes, the prune juice was a very good one. And then the nurses also got to know what I was responding to. So I had different, like ondansetron was very good.
Yes,
for nausea. Some of them weren't very good, weren't as effective. I shouldn't say as good, but weren't as effective.
Yeah.
And then I got into this habit of before I had literally in the hospital room as I was before the chemo sort of went into my veins, I would have something to loosen, like what do you call it? A drink. It was like a laxative. Thank you.
Oh yeah, like fibrogel type thing.
Yeah, I would take a couple of drinks of a laxative.
Yeah.
Just beforehand.
I know the one you're talking about.
It's
yeah,
Laxidose,
yeah,
isn't it?
That's a good-
the
yeah.
strong
That's the
one.
stuff
Yeah.
that I've been given.
Oh,
and
have you?
Really?
Have you suffered with that then, Natasha?
Yeah, twice.
Have you?
Got dehydrated. It's my own fault, really. After a long plane journey, I barely drank any water on the plane.
Okay.
And ended up in hospital for 2 days, not overnight, so 2 separate days. Severe compaction. Is it compaction? Is that what you call it?
Impaction.
Impaction.
It's horrific.
It was horrendous. Nothing was shifting. Nothing shifted for about a week.
Wow.
And ended up having to have suppositories.
Oh,
as well. It was horrendous. I
Was
was in
that
so much
osimertinib
pain.
with the osimertinib?
Yeah. Yeah, so what happened was I knew, well, usually with osimertinib is the other way.
Yes.
So it's usually diarrhea. So this came as a massive shock to me. But basically, like I say, I hadn't drunk enough water on the flight. Got back and got a little bit of constipation at first, but then it was horrific. So much so that all the muscles in my back were cramping. I couldn't feel the lower parts of my legs.
Gosh.
It's
my
really
hands went
dangerous,
blue.
isn't it, constipation?
Yeah, it can be,
My hands went blue, my lips went blue.
Wow.
But I was determined not to call it in.
I feel like there's a theme here.
Exactly. Soldier through.
That's it, I'll be fine. Husband comes home. I'm still sat on the toilet from the morning.
Oh my
wow.
Because I was scared.
Yeah,
I was
yeah,
scared
yeah.
of leaving the toilet in so much pain. And at one point I ended up, I think I screamed. I've got quite a high pain threshold. And I did actually scream. So he phoned an ambulance, which maybe was a little bit drastic. But
No, I don't think so.
anyway,
Protective and loving, I think.
And they sort of said,
Yeah.
it's going to be 4 hours. And it was like, right, get in the car now. But I thought I was literally going to mess everywhere.
Yeah, because you know the other side of the... Yeah, of course.
So, whizzed down. They wouldn't let me go. Gave me lots of the Laxido.
Laxido, that's it.
Yeah. Suppositories. Oh, I'll tell you what else I had.
Sounds exciting, but I'm not
I
sure.
know.
Enemas.
Oh,
Had a few of
God.
those.
Oh, did you? It's so
awful.
undignified.
It's very
isn't
But then he went the other
Yeah.
way. So that was one day, and then I had to go back the next day because nothing was shifting. So I went back, and I think I had maybe 5 or 6, and then they gave me it like enemas. Then they gave me some to take home with me.
Wow.
So the 5 or 6, I was over a period of time. But then he went the other way.
I'm not
And-
surprised.
No, I'm not with all that.
And so I couldn't leave
Leave
the
the toilet
house
then.
because I
Oh
couldn't,
my God.
and I couldn't make
But
it
that
from.
must make your tummy
Oh, it's
feel so
awful.
sore.
But it's also the confidence thing. So I couldn't go to the shops because I was worried. I mean, I couldn't get from the kitchen to the toilet at one point.
Oh my goodness.
It was horrendous. And then, it was awful. But I mean, after a week, everything's sort of like settled down again. But I know both you guys as well have had all sorts of problems with diarrhea.
Have
And-
you?
Do you know what? I've not.
Have
Touch
you
wood.
not?
But
Oh, brilliant.
I feel like you're the one to...
And we're all looking at you now, Maria.
Hey.
Maria's got a couple of stories.
Yeah, I've got some great stories. It usually happens, and so like you just get up and you've been to the toilet, everything's done, you think you're okay for the day, and I won't take Imodium because I don't want to. Other ones are available, obviously. I don't want to get constipation. So I think, right, I'll cope with it. So I had a wee before you set off for this walk, go on this little walk, and then suddenly it just comes over you and you have to go. So I have pooed in the woods outside Gareth Southgate's house.
Is that in protest?
Please forgive me, Gareth. He lives in this big mansion near where I live, and it's a beautiful place. And you're just walking along, and I'm thinking, and I was in a bright orange T-shirt because I was walking a mile a day for Roy Castle.
Right.
So it's just last October, Gareth, if you did see me.
I was going to say, I wonder if you saw you on CCTV.
Yeah, this is the thing. Because
camouflage.
I can tell you exactly, there's this massive tree outside his house, and I had to sit down and do the biz. And David's on red alert, my husband, going, there's nobody coming, there's nobody coming. Oh, Marie, there's somebody coming. So, yeah,
Oh, my
horrific.
goodness.
But you've got to laugh, haven't you?
Well, it's all you can do,
It's all you
isn't it?
can do, you know. And, hey, that's life.
Yeah.
You know, brownies do it, guides do it. Everybody who's done it on a big walk.
It's
Yeah,
just a
that's true.
wild.
That's true.
Yeah,
Marathon
just-
runners. What's her name? That lady that
Yeah, she used to cock
Oh,
her
she
shorts
did.
Yeah,
every week,
exactly.
didn't she?
Yeah.
So I
It's
put
very
myself up there
memorable.
with an extreme athlete.
Yeah,
Yeah.
but there we are.
I mean,
There
you were
we
in
are.
front of the English coach, right? His
Of
house.
the time, yes.
of
Well,
the
no, he
time.
wasn't of the time. He'd left by then. But let's say he's a very famous
Yeah.
person.
Yeah, yeah.
You know,
Yeah.
you've seen King
Might be
Charles.
Yeah.
Go
I know,
Southgate,
there's a
see
theme
my
going
bottom.
on here. Yeah.
Bright orange top
And
just
brown.
to draw attention.
Woo! Yeah, so there's been a few instances like that, and you think you're prepared. That's the thing. You think you are prepared. So my husband's gone mad with me now, so I have a little emergency bag. So within that, you have chapsticks, you have creams. I have an extra pair of pants, wipes, hand sanitizer, paracetamol, Imodium. So you're carrying your whole life on your back.
But that's a great tip, though,
Yeah.
Maria.
Yeah.
To
Yeah.
have a
An
pack.
emergency bag. There's a
Yeah.
little pack on you.
Yeah.
Yeah. I mean, I have it with me today.
Brilliant.
Yeah.
I think that's a brilliant idea
Yeah.
for people to have that. Because, I mean, in COVID, we were all wafting around with wipes and
Yeah.
sanitizers,
Yeah,
weren't we?
yeah.
So it's,
And
yeah.
it doesn't have to be massive and intrusive. It's just a small little thing, and it's got all your emergency.
Yeah.
Peace
and
of
that's
mind.
it.
And whilst
as
you're
well,
on that, you can get your little key as well, can you?
Oh, the
Your-
radar key.
Your radar key.
I've got one of them.
Because the amount of times when you're caught short
Yeah.
and you have
And
to
where do you
dash
get
into...
that from?
You can just get it online. So just Google radar key.
Okay.
And I
The
think
blue
costs
badge as
£5
well.
or something.
Yeah.
I don't think
Okay.
I even had to prove.
No.
Did you
no.
not? You
No.
just got one?
Yeah, I just got one. So anybody out
Brilliant.
there.
Yeah,
Yeah, that's a good
tip,
tip
actually.
for people to have then.
But
It is good. I have used that a time or two, especially if
have.
you're getting off the train and
Yes.
you're woo straight to the.
I used
'cause
it
you
at
don't
a
want
festival.
Well
I've used
done.
it.
Because no one
Festival
wants to
fast.
use festival
Yeah.
toilets.
No, they
so I was
don't.
like, I'll go to the... And also, also another side effect I find with osimertinib, it's not a major one, but it's like I can't control my bladder so well. So when
I've heard of
it's
that.
just
Yeah.
like I need to go, and it, like anything I drink, I just have to go
We've had that
quite
because we
immediately.
checked in with each other, haven't we? Because we didn't thought, oh my goodness, we've got really old all of a sudden, and we've got no pelvic
I've got
floor
it as
left.
well.
Yeah. I literally wee everywhere.
And I am.
It's just like, and I'm up
Yeah.
up in the night 2 or 3 times.
Yeah, yeah.
Which,
Are you?
Yeah, just needing to pee.
Yeah.
But you've got to keep your hydration up
I was
because
gonna
obviously
say,
it's a
yeah.
toxic
Yes,
drug,
yeah.
so you need to flush
Yeah.
it.
Yeah,
Yeah.
that's
Yeah.
it. Definitely.
Yeah.
Gosh.
But there's ulcers as well. Ulcers in your
Mouth
mouth.
ulcers, really? Did you
That's-
get that
yeah,
as well?
I get that. I do
And
get
how
that.
do you deal with that?
Well, in my emergency bag, I have the ulcer cream and I put it on and
Right, okay.
try and get it as soon as possible. But sometimes it can just get out of control for other people. I'm very lucky; it'll be like 1 or 2 spots. You get down about miserable for a bit about it because it's really, it really. You
Well, it
can't
must
eat,
affect. Yeah, I was going to say it must affect.
can't
what
eat
you
your
can eat.
crisps. Your salt.
When I saw you two
Ooh.
last, I had
You
ulcers
did, didn't
from
you?
my chemo, yeah. And actually, a top tip that I learned from another patient is to drink aloe vera juice. So
Really?
a shot of
need
aloe
to
vera
be-
juice.
Is this
I'd
like
check
prune
that.
juice again?
Yeah, but I can tolerate aloe
tolerate
juice. Yeah.
And is aloe juice okay to take with your
Yes.
tablet?
Are
It
you
is.
sure? I'd check.
Oh,
Just-
really?
Just
Yeah,
check. Just
I was
check.
just thinking that because
no.
when
Oh, really?
lots of our
I know grapefruit.
patients
is the
would,
other one, isn't it?
Seville oranges as well.
yeah, you
yeah.
can't have grapefruit.
No, I know that.
Yeah,
I'd just
But-
double check the aloe
yeah.
vera.
I used to say to
I must
my
have done 'cause
my
I'm really-
patients to
You will have done, I'm sure, but
Sorry,
you can
sorry,
double
Rachel.
check.
pharmacist.
Yes.
Because, we don't want to stop people having alternative and supplementary products. And actually, alternative products like your prunes, etc., for symptom control. But it is worth double checking that it doesn't interact with the mechanism of the
what
drug.
makes you say no? I'm just
Because
curious about this.
I've looked it up. I just Googled it.
Yeah.
And I can't remember if it was aloe or if it was something else, but I would just double check
Yeah,
it.
I
Just
feel
run
like
it
because I'm
past
pretty
your,
good at checking with
oncologist.
the
Yeah.
pharmacist.
It's
at the
probably
hospital.
okay,
I
but
think-
just
And
Yeah.
I don't take it at the moment because I'm not getting ulcers.
No.
So
Okay.
yeah, I took
So
it
maybe it's
before
allowed for a short
radiotherapy as
term,
well.
but double check with
Yeah,
your
yeah.
LCMSs and things.
Yeah.
Pineapple juice is supposed to be very good for
I'm
ulcers.
allergic to that just
Oh,
previous
no.
life.
Really?
Wow.
Yeah, I get.
Oh,
Yeah, I
BC
pineapple
before
juice.
cancer.
Yeah, yeah,
Yeah.
exactly.
But I think one of the other things that I used to say to our patients with mouth ulcers, because they can be unbearably painful, can't they, is if you get soluble paracetamol and you gargle and you wash your mouth with the soluble
Okay,
that's a good
paracetamol
tip.
and then swallow the paracetamol then starts to work on the tissues and will have more of a topical
Yeah. Brilliant.
impact on the pain and the pain control. So
I'll get some from my emergency bag.
put some in your emergency bag, some soluble paracetamol.
There's
yeah.
another one which is the infrared pen. You can just
Oh, yeah, I've heard of that actually. I've never
that like
used it.
£15 online.
on a certain site.
Certain site named
almost.
after a river.
Yeah.
Do
We
either
don't
of you
like
two get cramps? Because
Yes, I'm getting them right now.
Yeah.
I think it's
So
a
I've had
leg
hydration
cramp.
thing. Do you?
Feet and hands.
So when we were sat here
Suddenly it will
before,
do
my
that.
feet were
Yeah.
starting to cramp.
Really?
Yeah.
That's just started happening to me, and I'm going to speak to my oncologist on
Yeah,
Wednesday
do.
about it.
I've started to take magnesium on a night time.
Right. I've heard lots of people take that for sleeping.
Yeah, it's brilliant.
Is it good for cramps as well?
Maybe.
I'd just check with your oncologist
Yeah.
because there are other medications they may be able to give you to help with that.
Yeah, I've started drinking salt.
Electrolytes, they say,
like
don't
Well,
they?
yeah, and then
electrolytes.
I think the other thing is we all get fixated on drinking lots of water, but you need to replenish your electrolytes
Yeah,
and keep your gut
exactly.
healthy as well.
Yeah, I took something very good. I
yeah.
got through. Having learnt from Tash when she went on her holiday, I thought, right, keep your electrolytes up, Marie, keep them up. And I did. I took some with me. And, I think that really
The electrolytes.
got me through because I was in New York and it was like 35 degrees.
Wow.
So I kept,
Yeah.
it really helped. It really, really did help.
Yeah, that's
Yeah.
a good tip actually.
Yeah.
Just take
Because
electrolytes.
even if I've not, say like I don't have any water today, that's immediately tonight I will get cystitis.
Wow.
That's how quick it happens for me.
God.
So that's a side effect of a side effect,
Yeah,
isn't it? It's
yeah.
Really...
I get
So-
very sort of like sore down below as well if I don't drink enough
We
water.
had toxic, didn't we?
We
Toxic.
had
Oh,
talked about
really?
this, yeah.
You-
So it's the skin conditions. So it comes under
affecting
that. Oh, yeah.
The lady
The,
card.
yeah, your lady,
the lady
parts.
yes. Yeah.
And it's so,
How on earth do you cope with that then? Because
It's
I mean,
really
that
sore.
must be. I mean, just
It's-
I can't imagine what that must be like.
It's
They
horrible.
gave us some barrier cream.
Yeah.
We've both had it. And so the doctor, the oncology team gave us this barrier cream, but that actually made it worse.
Did it?
It's
And it's
okay
just
if you
so
put it on
sore.
before. So say if I was coming here and we were going to London, we're going to walk a lot.
Yeah.
I would put it on
Right.
without a shadow of a doubt because then you like you with your pre and it doesn't happen. If I don't do that and I go on a long walk, then something will. It'll
Gosh.
get all sore and it's horrible.
Horrific.
Yes, mine's more if I don't drink enough water as well.
Really?
But a lot of these side effects for me was when I first of all started osimertinib as
Right.
well.
Yeah.
And my body's almost got used to.
And
not
you've
used to it, but
adapted and got
yeah.
your, like Marie, you've got your
Yeah.
rescue pack.
Yeah. And the side of my bed, the things I have on there, it's amazing. You can just reach out and get it, It's just how you adapt, like you say.
Yeah. And how this has become your new normal, has it?
Yeah, definitely.
Yeah, I think, I guess we've all had sort of other treatments. And one thing I would say about osimertinib is the way that it allows us to live quite freely.
Yeah.
Like
Yes.
when I had chemotherapy last year, I had to change my whole schedule in it's very hard to work. Whereas when you're on osimertinib, you can kind of carry on as much
Yeah.
as normal life as possible. We can travel a lot more. You don't have to be in the hospital. Every
That is the beauty,
it's
isn't
pretty
it?
amazing.
It is
It
amazing.
gives you a really good
I'm so grateful.
quality of life, and it's sort of it becomes a part of your everyday rhythm, really.
Yeah.
And side effects come up and down, but
I mean, it's that saying, isn't it, that cancer is not supposed to define you, but it kind of does.
Yes, it does.
And you can't escape it. It's there. It's a presence in your life.
Yeah.
And you have to change to adapt, like you say, to what you have to do every day. You know you need it, and if you don't have it, you think, well, consequences.
Yeah.
You know.
Yeah, the consequences are huge.
Yeah, huge.
So,
Yeah.
It's kind of,
So I think, but it's very much, not to frighten people. Again, I'll go back to what I said at the beginning. It's in waves. And I think it's how you're feeling that month. It's how you're feeling that day. What can happen if you're busy on your feet all day, you've not drunk enough, and that's, it's just adapting, and every day is different.
And like we said, a lot of the time you can get sort of treatments anyway to counter these side effects. So not only did I get the rash, but I got really, really spotty.
Yeah.
I mean, I looked like a teenager, with like acne everywhere.
Wow.
It wasn't that bad. She felt it was that.
It
was. But your face was still beautiful.
I was wearing a mask at the time because we still had to wear masks. You couldn't see it. But it was really painful as well. But then so I have a daily antibiotic for that.
Right.
So,
There are treatments.
as you can see now,
You're beautiful. Absolutely beautiful. And we've run out of time, ladies.
Really?
Yeah. It's
That
been
flies by,
amazing
doesn't it?
Oh my
talking
gosh.
to you. And thank you so much for coming and sharing your experiences. It's been brilliant, and I've really enjoyed it. And it's been lovely meeting
thank
you
you.
all.
Thank you.
But thank you for doing this.
Thank you.
It's amazing. Honestly.
You're welcome.
Yeah, it's
So that's it, guys. That's a wrap. We've come to the end of season 1. I can't believe it. It's been amazing.
Oh, you're emotional. You fought so hard for it. It's wonderful. Honestly, I'm in awe of you.
Thank you.
Yeah.
I just say to people, we're trying to get funding for season 2. It would be brilliant if you could write in to breathestrong@hasag.co.uk to tell us how it's helped you, because this will help us get some more funding. Also, do write in, continue to tell us about your experiences, because that helps you feel not so alone. I hope today has helped you have some reassurance that other people are in this with you and you're not alone. So don't be scared to reach out. Talk to your lung cancer team. They're there for you, and so are we. So just to say thank you all, because we've had over 1,000 downloads. We've been in 25 countries. I literally cannot believe it. So thank you to every single person that's listened. It's just been brilliant for me. Life-changing for me as well. But I can't do this on my own. I know I'm here with my fantastic podcast team, but behind the scenes that you don't see on YouTube is a brilliant team. David has been with me from Orion Studios from day one. He's just been amazing.
We love David. Thank you, David.
We love you, David.
We love David. Love him.
And Angus from Orion Studios too. I'd
Angus
just
too.
also like to say thank you to Joanna, our marketing, and Laura for putting us out on social media and helping us grow. To EGFR Positive UK, to hashtag, sorry. And sorry,
We're used to tears. We do it every time.
Sorry. And just a brilliant thank you to everybody. To AstraZeneca, because they believed in us from day one, gave us the grant, which enabled us to do 8 episodes of this brilliant podcast. And so thank you. Let's hope we'll be back for season 2, where I can bring all our crew back together. And to those of you living with mesothelioma or lung cancer, your amazing network of families and friends, stay strong.
Breathe strong. Thank you, Rachel.